Welcome back to Takacs McGinnis Elder Care Law Hour. I'm Tim Takacs, and today we're talking about veterans benefits. What benefits are out there for veterans, their families, and in this segment we're talking about the VA healthcare system.
And I'm Barbara McGinnis, and specifically we're going to be meeting with Ms. Jennifer Vedral-Baron, who is the Director of the Tennessee Valley Healthcare System, and Dr. Marvin Stubbs, who is the Geriatric Extended Care Program Chief. Welcome, both of you. Thank you for being here this morning. Jennifer, can you just start us off telling us about the Tennessee Valley Healthcare System and what do you do?
Absolutely. We are a healthcare system that is centered here in Middle Tennessee. We have two hospitals in this area, one downtown Nashville, which is our tertiary medical center, and then we have a community hospital with long-term care capabilities in Murfreesboro, Tennessee, and that's the Alvin C. York VA Medical Center, so we're proud of that name. We also have 15 sites of care for outpatient care across Middle Tennessee and southern Kentucky. We serve 100,000 veterans a year that are enrolled to our system. And we take veterans from all over the country for transplant services. We're one of only 4 transplant centers in the VA medical system. So last year, 1.5 million encounters. We have women's programs, and so that's what we do. We provide the health benefit to our nation's heroes.
So it's a big company, right?
It is.
And you're in charge of it? Great. So can you tell us a little bit about what's the major services that the Tennessee Valley Healthcare System provides?
Okay, so we consider, we have foundational services, and then we have other services like specialty care, but foundational is really primary care, which includes our geriatric primary care, our women's health primary care, and then mental health care across the continuum from mental health that's embedded in primary care all the way through to inpatient care. Beyond that, we have rehabilitation, prosthetics, long-term care, which Dr. Stubbs will of course talk about, but really our bread and butter is primary care and mental health care.
Anything in particular that you think maybe the general public really doesn't know about that maybe should know about? Any thoughts on that? Yeah,
so something new for this year is what we call the Whole Health Initiative. We have been selected as a flagship facility for the VA, and so what Whole Health is we embed additional services into our primary care, which are considered complementary. They can help with pain, they can help with stress, depression, things such as massage therapy, Tai Chi, acupressure, acupuncture. So these are new additions this year that most folks don't know we're doing. They also will have health coaches, which will help educate veterans on their health care and how to really work through our system, which is very complex.
Oh, that's very progressive.
I just want to add something to that. One of the things we want to, first, thank you for allowing us to be here. We want to emphasize that we provide extended care for several years at the Alvin C. York VA Medical Center. And a couple of services that most aren't aware of, we provide chronic ventilator support services for our veterans. Back in 2009, we found out there was a large number of veterans considerable to the public sector was Lou Gehrig's disease, which the ALS. We have people who have that disease entity and they lose function from the head to the toe and they need to go on chronic ventilator service. And we started that back in 2009. There's about 124 community living centers, formerly known as nursing home care units, and only about 3 or 4 provide chronic ventilator care. Also, the York campus has a long and rich history of providing chronic mental illness to our veterans in Middle Tennessee. And there's only a few places in our community living centers in the nation provide chronic mental illness care for veterans who have burned the bridges and need to be in long-term care facilities. Unfortunately, it's said that veterans who have seriously mental illness, they can be at the age of 50, but their physical outlook is people 70 years of age. So we not only provide service for geriatric veterans, but also people with functional disability require long-term care facilities.
So are there specific programs for dementia care, or is it more general mental health?
Yes, we have a specific program for dementia care and for mental health. We have specialized unit for specialized veterans. We have specialized unit for people requiring chronic vent care, people at end-of-life care, special units, and then also we have two special units for people requiring chronic mental illness care. And we have 2 full-time geropsychiatrists on staff, and we tailor geriatric psychiatry with our geriatricians at the medical standpoint. So we team together and provide services, both medical and geriatric, for our people in our community living center, thereby decreasing the need to go to acute medicine or acute psychiatry. Our dementia area also, and dementia is a term that we put together, disease entity where a veteran or a non-veteran no longer can function in the community, can no longer take care of the ADL secondary to cognitive impairment. The common cognitive impairment is memory problem, Alzheimer's, dementia being the most common type. So we had a special unit for people with dementia, and what we do different at Tennessee Valley Healthcare is we change the paradigm shift. The old paradigm shift is when you hear of someone with dementia, hear someone needing nursing home care, what's the first thing you think about? What they can't do. Well, we talk about what can they do and build upon their best ability to function, and then also honor their preferences and honor their autonomy. Back in 2009, we looked at our dementia care program. We had a lot of veterans who was on medications that would slow them down. That was the standard of care with what we call antipsychotics. People on antipsychotics are 2 to 3 times more likely to have cardiac events than people not on antipsychotics. Antipsychotics are good therapeutic intervention for people with schizophrenia, etc., mental illness, but not the best therapy for people with dementia. So what we did, we educated, trained our staff, educated our family members that this was the way that we should not go. We should go with behavior modification, etc., etc. We provide education for our staff, not only our staff, but we also provide educational events for our family members. Every quarter we do educational events.
Dr. Stubbs, you mentioned a community living center.
Right.
Are those on the campus?
Right. Formerly known as a nursing home care.
Right. And so tell us a little bit about what a community living center is and how is that different from, you know, what, because it sounds like you're changing the way care is, long-term care is being provided to our veterans.
Right. What we try to do is a paradigm shift, look at
and that's the community living centers.
Community living center. The cultural transformation, the home-like environment, trying to make sure we honor their preference, their autonomy, etc., etc. Done in a formal nursing home care unit, we try to go to private rooms, etc., etc. Try to meet with the families, engage the family, ensure that they are still part of the community setting. We have outings for our veterans. Recently, we had an outing. Some of you may be familiar with David Price, former
baseball
Vanderbilt player, and former lived in Murfreesboro. He built this facility for people with disabilities. He allows the veterans to go there, and they had a really great time. And
That's incredible. Just like every time I hear about the veteran healthcare system, I'm so impressed with the variety of programs that are provided, the thought and research that goes behind creating those programs. It's always a question how to access. Jennifer, can you deal?
Right, and you're right, there are many programs. The best thing for a veteran to do if they've never engaged, and there are many, including my husband who's never engaged the VA system, is come to us. We have veteran benefits counselors in our main lobby in conjunction with the Tennessee State Veterans Assistance. They can go to ebenefits.va.gov.
Right, so I know we're going to have a slide up here in just a minute so that we can show our viewers.
They can talk to our patient advocates. There's so many avenues, the veteran service organizations. No veteran should go without assistance.
So here we go. We've got it up on the, up on the screen. So it's a 1-800 number you can call, tennesseevalley.va.gov. You have a Facebook page?
We do, absolutely, and we monitor that. If somebody has a question, we'll reach out to them as well.
So what can we do to help you in your mission to care for veterans? Just we got just a few seconds.
Right. Continue to do forums such as this. There are so many more programs we could tell you about, from our homeless program to our telehealth program to our home-based primary care. Continue to let us get the word out about the work that we do.
Great, thank you.
Thank you so much.
Thank you for being here. Thank you for sharing your information with us. Next, we'll be speaking with the Tennessee State Veterans Home to learn more about the services they provide to veterans in need. So please stay tuned.